Hey, I'm with Dr. Jill Carnahan, medical doctor. She is not only works with patients, so she's in the trenches, as I would like to say, but she also teaches practitioners. And today we're going to talk about mast cell activation, gut health, and so much more. Mold, Lyme disease, so stay tuned. It's going to be a great one.
Welcome to The Detox, Lyme and Health Podcast. Join Dr. J as he interviews experts focused on natural, holistic health solutions from around the world. In this podcast, the topics covered include Lyme disease, genetics, detox, nutrition, and much more. We believe in educating you and providing the tools you need to take your health into your own hands. And now, the man that simplifies the complex, your host, Dr. J. Davidson.
Hi, I'm with Dr. Jill Carnahan to pick her brain. She's actually in town teaching doctors, other practitioners, so I think that right there gives a lot of credibility to her. But she's a medical doctor, trained functional medicine. Give us a little more background. So I know breast cancer was part of your history, Crohn's disease, and then mold, I believe, correct?
Yes. Yes, I'll do the 2-minute version. Basically, 25 years old, medical student, loving school, going full force, long hours, and I found a lump in my breast, found I had breast cancer, and was in for the fight of my life. With young women, it's very, very aggressive, so I did all the chemotherapy, 3-drug chemotherapy, radiation, and surgery. And about 9 months later, I was considered cured, but I was very, very sick. And then thought I was done and had just beaten cancer, and 6 months later I had a diagnosis of Crohn's disease.
Wow.
And if you know anything about the immune system and inflammation, obviously the chemotherapeutic drugs kind of had an effect on the gut and triggering that inflammatory response. It was probably genetically predispositioned, and then I developed Crohn's. But I cured myself both from cancer and Crohn's through what I practice today, which is functional medicine. And very excited because I had to actually learn it myself. And now I'm very passionate about the gut and cancer and inflammation because it's such a big part of my history.
So both those things happen while you're in medical school?
Yeah.
So add a little more stress to the mix.
And if anyone ever says that cancer isn't related to stress, yeah, because obviously I loved what I was doing, so it was good stress, but 36-hour work weeks or 36-hour days, and then you'd have a day off every 14 days or so. I mean, it was crazy. It was before the work hour regulations, so it was crazy, and there's no doubt that the stress contributed to everything else. So yeah, and then I was doing well for a long, long time until I moved to Boulder and started to practice with Dr. Robert Roundtree. And we moved to a new office in 2013, and there was a flood in Boulder, and there was massive water damage unbeknownst to me in our basement, and there was mold, and I started getting really sick. So I didn't know it at first, respiratory issues, immune issues, and eventually found out that the mold was causing my illness. And the day I found out, I never set foot in my office again. I literally left everything, sold everything, started over, and that was 2014, like right after Christmas. It was December 26th, the day after Christmas. But thank goodness I did, because I'm healthy now and kind of cured myself from the mold-related illness as well, and but lots of things.
Yeah, well, I know we've discussed this before, but it seems as if, especially even in the Lyme disease world, that mold has such an intricate relationship of being like a stressor or maybe even playing a bigger role sometimes. I mean, what do you see as far as like mold, Lyme connection with everything that you've went through and researched?
Yes, it is so intricately connected. So the genetics, the HLA typing genetics, are like your sampling system of the immune system. So these are like your Pac-Man that are checking what's coming out from your environment. And those HLA types are the same in patients who get very sick from Lyme and get very sick from mold. So we see this massive crossover in genetics. Basically, they're the mutants that don't tolerate these antigens well, and their immune system gets this inflammatory response that just goes and goes and goes, kind of nonstop. And it's actually the immune system in Lyme and mold often that's causing collateral damage in the system, but that trigger they don't know how to deal with. So what I see all the time is this puzzle of which came first, the Lyme or the mold or both. And just in my clinical experience, here's my theory. I believe that you have patients who were bit by ticks when they were young. They probably have Lyme disease and they're doing okay. Maybe a little bit of joint pain or neck stiffness or fatigue, but they're doing okay. They go and get into a moldy environment, and then all of a sudden that immune system, I think of it as a limbo bar, kind of drops, and then all of a sudden these pathogens start to pop up like Lyme. So to me, there's a big connection between someone who has had a bite by a tick and maybe has Lyme disease but not really manifesting, and then getting into a moldy environment, and all of a sudden this massive inflammatory response, and that that the immune system is so impaired it can't really take care of it. So I think there's a lot of crossover.
Yeah, and that totally makes sense because one of the questions when you start thinking about even Lyme, it's like, well, if a lot of people have it but don't have symptoms, why is that? And it makes sense. There's got to be other factors that allow this bug, if you will, to...
When I'm in patients sitting in front of me, I will literally tell them, you have 10 Boy Scouts to go hiking in the woods. They all get bit by ticks. 9 of them will go through their whole life and be fine. They may have Borrelia if you'd actually test for them, and they might not have any symptoms or any manifestation of it because their immune system keeps that infection in check. But what happens is that one either has a genetic predisposition towards a weakened immune system or some dysfunction, and all of a sudden that inflammatory response starts. So it's more than just the infection and the tick bite or spider bite or whatever else. It's like that plus the immune system and genetics. So all those things kind of play to make the field, and that one person that gets sick gets really sick. And even sometimes, obviously there's a place for the antibiotic treatment, but there's also a place for this immune regulation and supporting that immune system to actually fight off the burden of infections.
So with thinking back, like with your past history, breast cancer, Crohn's within a short period of time, what do you mentioned stress, just the emotional stress of just being super busy, probably not sleeping, adequately, 36-hour shifts and whatever you guys did. What else do you feel like was part of that?
Oh, great question, because I have for 16 years kind of analyzed that, and I want to know more information because I feel like it can help patients. And I think there's a couple things. Genetics are huge, and I not only have the highest risk, we call the dreaded gene for mold and probably Lyme or infections as well, but I also have celiac disease and the high-risk celiac genetics. And in hindsight, that's part of my story too, because when I went gluten-free from the Crohn's, that was a piece of the puzzle of the healing. And do you know that genetics for autoimmunity, cancer, and celiac are all in the same gene?
Autoimmunity, cancer,
and celiac. They're all on the same HLA gene. Okay. So what I see is these patterns of people that are prone to immune dysregulation, so like hypo-functioning immune system, which is definitely what I had, which makes you predisposed to cancer. On the other side, they also have hyper-functioning autoimmunity, so they'll have this dysfunctional, like basically immune deficiency. At the same time, they have massive autoimmunity, and they are the ones also prone to cancer and infections and mold. So to me, it was a perfect storm. The genetics. I grew up on a farm in Illinois, and I know I had massive toxicity, like as far as pesticides and atrazine and things, and all of those are endocrine disruptors. Okay. So they have an estrogen-like effect on the body, and probably when I was very young, I got exposure and had this estrogen, stimulation on the body, and led to a 25-year-old shouldn't get breast cancer, but I did. So
and that's so young. I mean, 25.
Yeah, and what it is, people don't realize 55-year-olds, 65-year-olds, that's really common. It's a very slow growing. It's kind of like men and prostate cancer. Women who get it very young, as it was in my case, massively aggressive. Like it's a miracle that I am here, sitting here living, because it was a death sentence at 25. It's aggressive. It kills 25-year-old women. I was with a group in Chicago, 40, all under 40. There was 12 of us. I'm the only one still living.
Really?
Yes.
Wow.
Yeah, and that's how...
and I mean, you wouldn't know just looking at you. You look beaming health like you ever went through any of that before.
Yeah, I've worked really hard.
Well, obviously it shows, though, what you've done is helped, obviously, restore health. And so... Coming back to the genes, you've got the mold genes, which you think there's crossover with the Lyme. Is that the HLA-DR genes? Okay.
Yes, the HLA-DRs. And then there's the celiac genes, which I see sometimes in cancer. And again, for my personal story, that's a piece of it because it made me predisposed to a weak immune system and then autoimmunity. And then there's also SNPs with things like glutathione transferase and things like detoxification. And I have many of those as well. So the toxic burden on my body would have been excessive for my genetics to clear compared to a person who had really great genetics. And obviously toxic load, one of the things I talk about all the time with Lyme or mold or any of these things is total toxic burden. Okay. Because basically we all have this bucket full of capacity for our bodies to detox, and when that bucket of water starts to fill up and overflow over the top, that's when disease manifests. So this disease starts to manifest, and that's because that toxic burden is totally at capacity. And my job as a functional medicine doctor is to say what pieces are in that bucket. Could it be infection, toxin, poor genetics, and what things can we do to lower that water level to give you margin? Because anyone who has margin is going to be able to overcome and fight diseases and get over things easier.
And less likely to get triggered if you have some abrupt event, basically.
Exactly.
This total body burden bucket, if you will, mental stress gets put into
Yes.
that?
And thank you for mentioning that, because we kind of talked about, I love talking about the biochemistry, the physiology, all that stuff, but stressors, emotional, all this is absolutely critical. And as I get older, the more I realize that for me was a huge piece. I was always wanted to be successful and driven, but there's also that fear that drove. And I think fear and gut, fear and immune system all can drive. And as I overcame that, I overcame the illness. So people who have, irrational fears or anger, unforgiveness, and just regular old life stressors, lack of sleep, poor food. I always say clean air, clean water, clean food. And that's the core of how I got well.
Okay. The 3 cleans.
Mm-hmm. Yeah.
So, I mean, thinking back then, medical school stress obviously was adding to the bucket, the past exposures, growing up on a farm with pesticides, your genetics just make you predisposed, not being able to pull chemicals out is easy, basically. And then would you put physical traumas into that too, like car accidents, falling off a ladder, those kind of...
See, I love that with your background, because I sometimes forget that that's such a critical piece. But yes, because the whole systemic parasympathetic sympathetic nervous system is governed by the pathways working, and when you've had past automobile accidents or trauma or concussions are huge, it definitely affects that. And I had several car accidents. I think 16 and 17, I had 2 major auto accidents.
Oh wow! So just you feel like all those things was what filled the bucket, overflowed, boom. Cancer diagnosis, then Crohn's, and So in your journey, what was it that seemed to be big help? Removing gluten, and is the gluten genes, are they the HLA-DQ?
Yes,
okay.
And they're
they're
actually
so close to
they
the mold.
are, and the DR, so it's DRB1, 3, 4, and 5, and then DQ. And that puts together what you calculate for the mold and Lyme risk, but the DQ is the celiac. So the celiac is actually a player in the mold and Lyme risk.
Oh, really?
Yeah, they're connected.
Okay.
So it kind of adds into that burden. Like people who have celiac are more prone to, or they could be more prone to Lyme and mold as well.
Okay.
But genetics, let's see, your question was...
Well, I guess just in looking at like what were big turning points for you in your healing? So
the first thing was I was born to overcome. You can obviously tell that by now, but I was born, I know it now, I didn't know it when I was 25, but I was meant to have these obstacles, and I was meant to have a purpose in these obstacles by helping others through that. So once I found that, okay, this suffering has a purpose, I'm going to use it, learn from it, and then get on with it. And I also have this like insurmountable will to survive, like I'm going to beat it. I just know it, and I know it in such a depth. So no matter what comes my way, I know that I'll overcome it.
Awesome.
Somehow. I don't always know how, but so that's pretty big, because that drive to survive, and you see it in patients, and you see it in your clients, and I see it too. And when you have someone in front of you who is like motivated and they are going to do whatever it takes, you can help them.
Yeah.
Right?
Yeah.
Same way. So that's huge. And then when I got the Crohn's diagnosis, I sat with my gastroenterologist. He said, you're going to have this forever. It's incurable. You're going to need surgery through your life. You're going to need steroids now. You're going to need immune modulating drugs eventually if those don't work. And diet has nothing to do with it. And I just looked at him, and I was just a third-year medical student. I didn't know a lot. I knew I had some nutritional background. I didn't know that it could cure Crohn's, but I also knew that that wasn't truth, and it didn't ring true intuitively. I knew that can't be. So I fired him, and I went to study and look, and I found a Elaine Gottschall's specific carbohydrate diet book.
SCD.
Yes.
Okay. So
that's what I was like, well, what do I have to lose? And I went on the SCD diet, and within 2 weeks I was almost symptom-free. And now in hindsight, it's gluten-free. So of course that's going to have a big piece of it, but there was more to it. I mean, I had to fix my microbiome over the years and did a lot of work on that. So I know the gut really well. But that's a big piece of it, was fixing the microbiome, calming the inflammation, fixing the leaky gut, the permeability issues in the gut, and then changing my diet. And pretty much from 2002 on, I've been mostly paleo, gluten-free, dairy-free, nut-free, egg-free, sugar-free, alcohol-free, super clean. And I am absolutely, I will, like with travel, I'll bring food with me if I need to. I don't cheat, because to me, health is more important than,
No gray zone. It's just...
Exactly, it's black and white.
Okay. In for the listener, also you... Chronic Lyme Disease Summit number 2 interviewed you about SARS or CIRS, CIRS, and then you're on the upcoming Parasite Summit as well too. So you can definitely catch more information about Dr. Jill there. So thinking about you mentioned the gut. Mm-hmm. Seems as if a lot of people with health issues have gut issues, mm-hmm. and especially in the Lyme space. What do you find to be just, like if a client comes in and is like, Dr. Jill, I just, my gut is a mess, go to the bathroom all the time, or I'm constipated. Oh, and that actually reminds me, in chiropractic school, my roommate, one of my roommates, was diagnosed with ulcerative colitis, and the doctor at the Mayo Clinic said that diet doesn't matter for you. And even at that time, I'm like,
come on.
It's the gut, like it's what you put in, like really? And obviously, didn't know a lot then, but so it just reminded me because what they obviously told you with Crohn's. So, so looking at the gut, somebody's coming in with gut issues. Where do you start navigating with the digestive tract?
Great question. So I almost always, on a new client, will do stool testing to check the microbiome and for any infections or imbalances, and then I'll do organic acids because that gives me a glimpse of things that may not show up in the stool, metabolic changes or whatever. And typically I will look for bacterial overgrowth, fungal overgrowth, parasitic infections, which we'll be talking about, anything that's imbalanced, and then trying to create a balanced environment. And then the inflammatory piece is really important because if they have this, runaway inflammation, you have to stop that process. And a lot of patients are like, oh, I have leaky gut, let's heal it. Well, you can throw glutamine or Restore, some of these things to heal a leaky gut on board. But if you don't fix the underlying imbalance first, you have to fix the microbiome first, and then you can fix the leaky gut. If you have a massive small intestinal bacterial overgrowth, you're never going to get leaky gut healed until you treat that. So you kind of start there. And what I usually do is start with the gut because 50%, 80% of people get better. And it's those 20 or 30% that don't get better that I'll say, okay, is there mold or Lyme or something else going on? Because it's always easy to start with the gut, see what you can do, and maybe they'll get 50% better and then get stuck. And my job as medical detective is to say, what else is going on? What else are we missing? And keep going until we get the answers. So usually what I'll do, and what we find with Lyme and mold is a massive toxin to the gut. It causes the enterocytes to have massive permeability and tight junction issues. And it also creates this inflammatory response. It lowers MSH, which MSH has a lot to do with the tight junctions. So if MSH is low, you're going to have a permeable gut. And so very, very toxic. And there was studies with children in Africa with mold exposure through their food supply. And it actually showed the massive intestinal permeability was created with that. So there's very clear evidence for that. And then with Lyme, we have the infection causing inflammation. And what I see more with Lyme is the motility. So we often have this autonomic dysfunction. So Lyme can affect the nervous system and cause this autonomic destability where there's slower motility. So it's almost like the bowel is just shut down and sluggish, and the movement isn't going through, especially the small bowel, which is governed by the migrating motor complex, and that complex is just paralyzed. And so you have this like stagnant, like a pond with pond scum. And you have this like overgrowth of bacteria and fungus and stuff happening in the gut. And of course it leads them to have massive symptoms. And when I find someone who I try to treat for SIBO or candida overgrowth and they're not getting better, often it's that motility piece. And we see that all the time with Lyme.
So with motility, you mentioned really moving to the bugs basically first to help the microbiome, or to help the gut is the microbiome. Are you also addressing like the microvirome, the virus? I mean, what is it? Like going after, so you've got the good bugs, the bad bugs, you've got the middle bugs, commensal, or I like to call them squatters. They're just there, you know. I mean, is there a point, and it obviously depends on the person, but are you looking to clear some of the bad stuff out and then put good stuff in, or what's kind of your approach looking at the digestive tract?
Yeah, typically, and now we are just starting to check the virome. I find less of that, and it's almost an intuitive sense because of checking for viruses is very difficult. We don't have great measurements. I do a PCR stool test that does detect some of the major like gastroenteritis type of viruses, but a lot of people don't have that, and they might have Epstein-Barr or CMV or HHV6. So usually what I'll do is I'll check the PCR stool test, and then I'll do a scan through like serum labs of HHV6, HSV1 and 2, Epstein-Barr, CMV, varicella, kind of the main viruses. And there's no perfect way because most of these are going to be past infections, but with some of them you can kind of see if they're all really high titers, they probably have a heavy viral load, and there's ways to treat that too. Typically I see that presenting with more fatigue, but it can affect the gut. And otherwise, if we have bacterial overgrowth, the best test for small bowel overgrowth is a breath test. So we'll do stool and breath, and then we check the colonic bacteria in the stool and the small bowel with the breath. Candida can be tricky because you have to have a high index of suspicion. Stool tests, people are like, oh, my Candida was negative on the stool test. It can be in the small bowel and be totally normal on the stool test because that's checking colonic microbes.
Okay.
So typically with Candida, I'll check serum, IgG, IgA, and IgM and look for a pattern there. And that would be if there's crossing over into the immune system through the membranes of the wall, like if there's leaky gut, it's going to cross over and create this immune response that you can measure in the blood, and that's IgG, IgA, IgM. And then I'll check organic acids in the urine, and there's metabolic markers like rhabinose and others, and if those are high, that's another marker, and then we can check the stool. So there's kind of 3 or 4 ways that you want to check the Candida.
So it's not just one way, it's kind of looking at a bunch of tools and gathering information from that.
And then symptoms, so if they have a white coating on their tongue, there's Candida. If they have massive sugar cravings, if they have, women history of vaginal and frequent vaginal yeast infections, weakened immune system, there's lots of brain fog's real common. So kind of depending on if they eat sugar and they get really foggy brain and tired, that's common too.
What about the toe fungus? Would that relate to Candida?
Yes, so onychomycosis is always a marker of systemic yeast or Candida. So, and it may not be Candida, it could be other fungus, but fungus in general, all treated the same.
So if somebody does a breath test, coming back to SIBO, or you sometimes hear SIBO, SIBO, small intestinal bacterial overgrowth, there's 2 types, right? There's hydrogen and then methane.
Methane, correct.
Depending on what the test shows, what are you going after from a SIBO standpoint?
Yeah, and this is very common. So probably 60 to 80% of IBS is SIBO. And IBS is a big catch-all diagnosis. It's a diagnosis of exclusion where you have intermittent symptoms of gas and bloating and diarrhea, constipation for a period of 6 months, and very generic. But most IBS is actually SIBO. Okay. So it's a very good thing to be checking for. So we check a breath test, and they test for both methane and hydrogen in the breath. If methane is above if methane is above 3, if hydrogen is above 20, and if they're both above 15, that's positive. And so if you have hydrogen, you're going to be more likely to have increased motility, which would be like IBS-D or diarrhea IBS. And if you have methane, the little methane guys eat the hydrogen, and the methane slows motility. It kind of paralyzes the bowel. So with methane predominant, you're going to have constipation. And a lot of docs get confused because they think that SIBO is always diarrhea, and it's not, because you can have the methane type. The methane type is much harder to treat. The hydrogen type you can very easily treat with berberine or garlic, or I use often Xifaxan or rifaximin, which is a medication that works amazing. It's not systemically absorbed, so it's quite safe. And people can do even multiple courses without resistance and get very well, and that's hydrogen type. The methane type, though, is tricky. So herbs don't work very well. It's from a archaea type of bacteria, so it's this ancient type of bacteria that doesn't have cell walls, and so it's very resistant to typical antibiotics. Okay. So Xifaxan alone doesn't treat methane, but if you add either neomycin or tinidazole or metronidazole, you can treat it with both drugs. But I find that methane is harder to treat, and methane is more common in Lyme.
Interesting. Again, well, and you mentioned the slower motility, though.
Exactly. It's all connected, I think.
And I would definitely agree with thinking back from a client standpoint, slow motility.
Right.
Almost always.
Even gastroparesis, which is more the upper with the stomach, where they get nauseous after meals and food just sits there. And it's tricky. There are a few things you can do to treat motility. Low-dose erythromycin can be given. There's a drug from Canada called Resolar that can be effective. Low-dose naltrexone, which is used as an off indication for small intestinal bacterial overgrowth or motility, that can work. And then there's some herbs. I like a product called Modal Pro from Pure Encapsulations. Okay. And then Abriogast is a German homeopathic that's great for motility. It's been harder to get lately, so I don't know if it's still available, but that was something I used to use a lot. But it's a trick to kind of get that motility going.
So if I'm thinking back what you said, so SIBO is a majority a part of IBS symptoms, which IBS is a pretty big thing. Could we kind of look at from a symptomatology, like, oh, my bowels, like I'm going all the time, I may be a little more hydrogen prone. Oh no, I'm backed up, I'm constipated like all the time, more methane. Yes. Could we kind of jump there, or?
Yes, so say you have this big category of IBS, and then say 50 to 80% of that is SIBO, you can test and exactly methane or hydrogen. And then that other percent, parasitic infections, candida, so you could have other things that are causing IBS-like symptoms, but a lot of it is SIBO.
What do you think, I mean, like, why are we having SIBO? Like, where do you think the cause or the upstream source? Because it seems like anything, I just think of this, anything going on systemically in the body ends up like dumping bad stuff into the gut. You know, like the gut ends up like catching all the, you know, it's like secondary, you know, so trying to get the gut well, if there's other things upstream, just seems like it's kind of a, you know, can be a battle at times.
Absolutely. So I think you kind of hit the nail on the head. It's like this toxic sludge. So first of all, our environment nowadays is so toxic. We're swimming in toxic soup. There's toxic chemicals. There's new ones approved every day. There's things that are added to our food. So unless you're eating super consciously and clean, organic, whole food, you're getting exposed. The kids especially, sadly, unless parents are really observant about what they feed their kids, lots of additives and colorings and chemicals and then pesticides. And the amount of, for example, Roundup that's being used compared to even 10 years ago is astronomical. So any soy or corn or wheat that's not organic is going to be loaded with pesticide. And Roundup, like mold, is one of the most toxic things to the tight junctions. So we see this massive permeability, inflammation, sluggishness, and whether it's people being less active with movement, not eating enough fiber, getting the toxicity, and the toxicity I think affects the load too. So it's kind of like this toxic waste dump, and sluggishness happens, and overgrowth happens, and all that.
So mold, so if, and correct me here if I'm wrong, so the digestive tract is pretty much single cell, it's just like one layer.
Yes.
And our skin's like 7, so the digestive tract's very sensitive.
Yes.
But you're talking about tight junctions, so it's essentially these cells, if they get exposed to mold or if they get exposed to glyphosate, Roundup, that they'll open up essentially.
Yeah, both Roundup and mold are super toxic to those little, think of it as a trapdoor between the cells. The tight junctions hold that together and keep things from going through. Or you could think of it as tiles with grout, and that gets dissolved or ruined, or the tight junctions, the doorways get opened up. And zonulin has a lot to do with that. And nowadays we can test zonulin. Zonulin's kind of like the trapdoor. But Roundup and mold definitely massively affect those trapdoors between the cells. Interestingly, too, you mentioned about why SIBO, dysbiosis, Roundup, again, which is heavily in our food supply now, it will preferentially kill lactobacillus, which is one of our main healthy probiotics, and it will allow the Clostridia species to grow, which is a pathogenic in excess. And we're seeing epidemic C. diff colitis, which is Clostridia in our humans. And the cows, incidentally, that eat the Roundup-laden grains are getting massive epidemics of colitis from Clostridia, which is the human equivalent from C. diff colitis.
And lactobacillus is primarily in the small intestine.
Colon. Colon, actually.
Well, isn't bifidobacteria primarily like a colon and or is it lactobacillus and bifido or both?
Both,
okay.
yeah.
Okay.
So we actually should have a pretty sterile small bowel, which is why when we get that overgrowth or migration. And you mentioned, physical activity or accidents. The ileocecal valve is a huge piece of the puzzle because that's the valve between the small bowel and the large bowel. And if people have some reason where that stays open, they have that basically backflush of bacteria into the small bowel as well.
So that could be a cause of SIBO then?
Yes.
That ileocecal valve. Right. If somebody has an ileocecal valve, is that like literally like a physical...
There are people in your profession and physical therapists that can manipulate it. I don't know how, but I send them to people who do.
Yeah, well, I never did the ileocecal valve, but I'm just imagining,
you can
like
totally
physically, massage that. So we've got the gut being a big thing with just getting people well overall.
Yeah.
What are some other maybe conditions or things that you see more frequently? Like, did you mention dysautonomia I actually want to ask you, mast cell activation, or the whole histamine-like type thing. What's your take on this? Because I feel like you didn't hear about this a few years ago, and I feel like it was just defined, a few years ago. But you're hearing about it more and more and more. What's your take on it?
And a ton of our patients are affected, Lyme and mold especially.
Okay.
So I think what's happening, once again, we're back to that bucket and how the toxic burden is really large compared to what it was 10 or even 20 years ago. And so we know with mast cells are very reactive to our environment, and mast cells can be triggered by hormone excesses, excessive heat, excessive cold, infections like Lyme or other types of infections, toxins like mold or other toxic exposures. So there's a ton of things that can cause someone's mast cells to kind of go nutty and go crazy. And what we're seeing is a lot of patients who have a mold exposure. Mold is probably the most, I talked to Dr. Theorides, who's a Greek doctor who does all kinds of mast cell research and education. And he was just saying how some of his mold patients are the most reactive with the mast cells. And what happens is these mast cells in our body get extra active. So there's an old disorder called mastocytosis, and that was more of a bone marrow thing where there was excessive production, like if you had, aplastic anemia or some disorder where you had dysfunction of the production of the blood cells, and that would be mastocytosis. These mast cells get overproduced, and that's kind of almost like a precancerous type of thing, and it's very rare. Now what we're seeing is your and my own mast cells that aren't too many in production, they're just overreactive. And they're triggered by an environmental exposure, a toxin, a hot or cold. And what can happen is someone gets a mold exposure, that triggers this massive mast cell production of chemicals which make people feel poorly, histamine or prostaglandins or things. But even more so, then on top of that, cold, hot chemicals can trigger them even more. So they're just super sensitive.
In mast cell, because I feel like you hear the histamine word all the time, but there's more to mast cell than histamine.
That's so important because we know about histamine, we know what it does, but the mast cells actually produce probably hundreds, maybe even thousands of chemicals, and there's a lot of other activity in the body from heart, GI system, pain, brain, and it's all affected by the mast cell products.
So when histamine gets brought up, I immediately think like liver, but mast cell is a whole systemic body.
Yes.
Reaction, basically.
Yes, it can affect, things like brain fog, poor focus, concentration issues, heart palpitations, POTS, or orthostatic issues with patients, the gut, so increased motility, decreased motility, pain, diarrhea, and then skin, lots of types of rashes and things. Pretty much any organ could be affected by mast cells. Okay.
In that, so if somebody's like, well, how do I know if I have mast cell? Is there like a test, or are we looking at symptoms like, you seem like you're sensitive to everything, you must have mast cell?
So it is a clinical diagnosis. There are tests. They're kind of esoteric, and I have them listed. I have a blog I wrote about it. Even on the top of my head, I can tell you tryptase is common, but there's a whole list of more. And if you want, someone wants to look them up, just Google mast cell disorders and my website, and it'll come up. Because I have them all listed. But so you can test, but what happens in mastocytosis, the disorder in the blood, will often show up with positive tests, but these mast cell activation syndromes will most of the time be negative. So I've tested probably more than a dozen patients, the full panel, and probably 99% of them are negative on all tests. So then clinically you say, well, does it fit the symptoms? And again, on a blog I have a whole list of symptoms, but typically rashes and palpitations and increased motility in the gut and brain fog, and there's a whole list of things. And if they fit that and then they respond to treatment, that's how you diagnose it. So treatment, complicated because there is all kinds of antihistamines, mast cell stabilizers, H1, H2, so things like Zyrtec, Zantac, Allegra, ketotofen, Tranilus. There's a whole list of things you can use, and you kind of do trial and error. And then there's natural things like N-acetylcysteine, R-lipoic acid, quercetin, bromelain, and those all work really well too.
And they all seem like they're allergy related. So if somebody maybe like quote unquote treats allergies and feels better, it could be mast cell to some degree.
It could be because the typical antihistamines are actually one of the first line of treatment. So yeah. And then you can get creative because there's lots of other things like Singulair, which is an asthma medication, but also a mast cell stabilizer, and for some people that works. Gastrochrome or cromolyn is for the gut mast cells. So if someone has this massive histamine issues with food, with their mealtime, the cromolyn can do the trick.
Well, we'll make sure to put Dr. Jill's blog article on histamine, or I shouldn't say histamine, mast cell activation, right in the show notes, so you can check that out for sure. Where do you see, if you look 5-10 years from now, because you teach practitioners, so you get a different viewpoint than, besides just working with patients, you're also working with practitioners that are obviously working with patients. Where do you see the next 5 or 10 years going for mast cell?
It's huge. I think it's an epidemic, and again, because we're so toxically overloaded, and that's a stimulation to the mast cells, and it's not easy to treat. So patients are often like, oh, how do we test for this? What do we treat? And it's more complex than just a one-size-fits-all. But part of that is back to the bucket and back to decreasing the toxic burden. So to me, it's like we have this massive load on our systems. We talked about stress and then infection and then toxin and heavy metals, you name it, and all of our systems are overloaded. And some people like me genetically can't tolerate it, so I get sick. Some of our patients do too. A lot of people are walking around doing okay until the thing takes them over the edge. But right
stressor.
now, stressor or infection or something. But the goal is still to decrease that total burden, infection, toxin, whatever it is.
So everything essentially, I mean, comes back to the total body burden. Like no matter what you're dealing with, there's probably an issue with the total body burden. You almost, not make a blanket statement, but you can almost benefit by just trying to empty that bucket off.
That's always what I'm doing every day. Exactly. Yeah, just thinking about what could we take off the system to allow it to actually function.
Could we just pour a bunch of like charcoal or clay and absorb all that out?
Exactly. That'd be helpful.
Awesome. Well, is there any other things to leave the listener with, final tips or thoughts that you want to leave the listener with today?
Well, stress is huge. I love to talk about the biochemistry and all that, but I think sometimes when people just address the stresses in their lives, the, unforgiveness and anger and broken relationships, healing those things are huge, and people often think they're not related to their health, and they are. And then the other thing, I think there's so many people out there, I get emails every day, I'm sure you do too, they're so sick and they're so discouraged and they're so hopeless. And if there's one thing I would want to tell people who are listening is that there is always hope. Like I've had the most sick people in my office, and there's always hope. I never feel like you want to give up on people, and especially when patients themselves feel like they want to give up on themselves, that is devastating. So just having that hope is critical to healing.
So coming back to the very beginning, when you mentioned like you're an overcomer, if somebody doesn't have that coming out of them, is there a way to bring that out of somebody?
You bet. So we can teach our subconscious whatever we want, and our subconscious is the rule book by which we will play. Hands down, there's no question. Our subconscious just carries out what it believes. And repetition will create that. So you can, on your meditation, on my walks in the morning, I can't tell you how many times I would talk to myself, I will overcome all obstacles, I will outlast all adversity, things are turning in my favor. I know that, my cells know it. So you can tell yourself that, you can teach yourself that, and your cells start to believe it, and it happens.
Okay.
Yeah.
So it's what you say to yourself regularly gets into the...
You have to believe it.
Okay.
But repetition turns to belief, and it is very, very powerful. Yeah.
Awesome. Yeah, because I'm like, any tips you have for when I talk to clients, I'll take them for sure. Yeah, because I will say, somebody that's like, I'm going to do this, I know it's like, great, game on. You're totally going to overcome this because you've got that attitude.
Yep.
Somebody that's like, well, I'm just not sure if... It's like, okay, we gotta first talk about the mind.
Start with attitude, exactly, because mind is really core on this. Okay. I mean, you've seen people or read stories about people who've lost their limbs and like they're still out there surfing, or they're, they've had 4 bouts with cancer and metastatic stage 4, and they overcame it. And there's stories, and that tells us the power of the mind is way more powerful than our medicines or our herbs or our protocols.
Yep.
And if there is one thing I would teach patients is how do you really have that mindset to overcome, because it is critical.
Awesome.
Yeah.
Awesome. I'm so glad you're able to come and allow me to interview, to get your message out. So obviously gut, mast cell activation. You've got an amazing website.
Thank you.
drjillcarnahan.com, correct?
Just jillcarnahan.com.
Jill Carnahan, sorry.
That's
Leave
okay.
the doctor off. Jill, we'll make sure to tag it too in the show notes, but jillcarnahan.com. Carnahan is Carnahan. So definitely check Dr. Jill out there. And again, we'll post that mast cell activation article there too. But yeah, I just really appreciate you taking time out. And she's actually speaking practitioners tomorrow. So I caught her right before she's ready to go on stage. So
thank you. I've had a blast, and I appreciate you. Great questions, and I hope this is helpful.
Oh yeah, absolutely. So we'll see you on the next podcast. Be blessed.
Thank you for listening. If you found this podcast valuable, feel free to share with others. The information in this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Please seek the advice of a healthcare professional before changing your health program or embarking on a new one. To find more information and additional resources, please visit us on drjdavidson.com. That's drjdavidson.com. That's drjaydavidson.com.